Hi, this is Dr. Matt Greenberg with West Suburban Wellness of Oak Brook, and today we're going to be talking about a condition that I see in the clinic quite often, and also a condition that many people have heard of or experienced, and that is sciatica. Now I want to start by going over the anatomy of the sciatic nerve because it's important to know and understand why you get the symptoms you do with this. So if we go to this chart right here, we look and we can see that the sciatic nerve, it's a very large nerve. And it's also important to note that it comes off the L4, L5 area, as well as down into the sacrum or the tailbone area. Now, this area up through here is what can cause pain into the back instead of the leg. And down through here is why that pain can travel all the way down the back of the leg, even down into the foot. So, again, a condition we see quite often due to compression or irritation on that nerve. Now, how does that happen? Well, one of the main reasons is a disc herniation, especially since at that L4, L5, that is the most common area to have a disc herniation. And if you have disc material coming out from the spine, it's going to put pressure on that nerve and give you those sciatic symptoms. Other things are age-related changes such as arthritis, or without getting too technical, something called stenosis, which is a narrowing of the canal where the nerve comes out. So if the canal is narrowed, of course it's going to put pressure on that nerve. Now, one of the biggest things that we see, or one of the biggest reasons for sciatica, especially these days, is prolonged sitting. Since so many people are doing it and so many people are at home now, we're seeing such an increase in sciatic symptoms. So what's really important is, if you're having pain in the back, if you're having these symptoms down your leg, you must, it's really important that you get your spine checked to really understand what's going on, to really rule out, is it a disc herniation? Is it that stenosis? Is it due to a subluxation, a misalignment of the spine, putting stress and pressure on the nerve at that level? Really summing it all up, I would encourage everyone and anyone to come on in, get a spinal check, and make sure your nervous system is clear.